When we talk about the drug crisis, it's easy to picture it unfolding in big cities, bustling urban areas where people often feel anonymous. But there's another side to this story, one that's happening in small towns and rural communities all across the country. Places where everyone knows your name, but where the struggles of addiction are just as real, maybe even more isolating. These are communities that have been hit hard, not just by drugs, but by decades of economic decline, underfunded healthcare, and a lack of opportunities.
Here's a number to think about. In Terrace, a small town in British Columbia, the overdose death rate is 157.9 per 100,000 people. That's among the highest in the province, far exceeding many larger cities. And Terrace isn't unique. This pattern is being repeated in rural communities everywhere. The reasons are complex, but they're not unfixable. Poverty, job loss, and limited access to healthcare are all part of the equation. But so are the stories of resilience, of people in communities fighting to take their lives back. Today, we're going to talk about what's happening in these rural areas. We'll explore the challenges, the systemic failures, and the potential solutions that could help turn things around. Because these places matter, the people in them matter, and their stories deserve to be heard. Before we begin, let us introduce ourselves. My name is Matthew.
And I'm Garrison.
And we're both from Terrace, BC.
And like many other small towns, Terrace has been facing serious challenges over the years. I've seen how poverty, job losses, and lack of resources have created struggles that many of us couldn't have imagined growing up.
This is why we found it valuable to discuss this topic today. After seeing firsthand the impact that drug use has on an already impoverished rural community, we found it important to have this conversation.
So let's dig into what's happening, why it's happening, and how we can start to turn things around.
Let's start back home and explore the devastating overdose rates in Terrace, British Columbia. As we previously discussed in 2023, Terrace recorded 157.9 drug overdose deaths per 100,000 people. That's the second highest rate in the province.
These numbers are pretty shocking, especially for a community as small as Terrace. I know we definitely saw it growing up, and it just got worse and worse. As more people moved away, I think we saw more homeless people on the street and just more people taking drugs in general. It's crazy to say that, but growing up as young boys in Terrace walking downtown, we would see people overdosing, and it's just not a great environment for anyone to be in. And I think it's all due to the economic problems that Terrace has, because when workers and everything moved away, it just got worse.
And that's not to say that Terrace didn't have problems, but they definitely amplified as we got older. Terrace is considered the hub of the Northwest, but its economic situation is worse than surrounding towns like Prince Rupert, Kitimat, or Smithers. And while Terrace has a larger population than most of the surrounding towns, it struggles to keep up with the rising issues that it's facing. While we're on the topic, let's examine how economic downturns in rural areas contribute to substance abuse. According to ASPE Research Brief, areas with higher poverty and unemployment rates tend to have greater rates of opioid prescriptions, hospitalizations, and overdose deaths. Let's, for example, take a look at what happened after COVID-19. We saw a lot of people laid off or fired from their jobs, and this increased the financial burden that they had to deal with, increasing the stress that they already faced due to the global pandemic. In such scenarios, it's obvious why some people may turn to drug use. It can take them away from the realities that they face each passing day.
And because of the losses of jobs, the healthcare systems in rural communities are now failing to meet the demand for addiction services. Rural community medical services face long travel distance, longer response times, and staffing shortages now, making overdose response difficult.
This only amplifies the negative consequences that come with drug use in rural areas, as when the response times aren't fast enough, people suffer. And these people suffering are often left out in the streets, in the cold, and it's truthfully hard to see. First summer, I worked security at the Terrace Airport. And while I was there, I was told that if someone was overdosing in the airport, I wasn't supposed to call the police because their response time would not be fast enough and they didn't have the resources to deal with the overdose. Instead, I had to call bylaw, and who knows how long that takes. It could be 45 minutes, it could be 2 hours. Still, that person is left suffering.
And this just leads to an increased number of overdose deaths in rural areas. According to Baker et al., rural areas face unique challenges in reducing overdose deaths compared to urban communities, including limited access to harm reduction services and greater concerns about stigma and privacy. And this is definitely untrue because especially in Terrace, healthcare resources are really scarce. Terrace does have a hospital, but many towns nearby don't have one, let alone specialized addiction treatment centers. The lack of access means that even when people want help, they may not be able to get it. And stigma and privacy really is a big concern. I know with my sister growing up, she was unfortunately an addict, and she was completely petrified to go into the hospital because she was worried that her friends might find out or other extended family members might find out. And there was just this embarrassment surrounding drug use, even though it's one of the most prevalent things that happens in our community. People are still afraid to talk about it and go seek help.
Now, continuing on the topic of the stigma around seeking help, from the same study, a fear of being identified by law enforcement or facing social judgment often stops rural residents from calling 911 during overdoses. As Garrison's sister experienced, being in a small town means privacy can be a luxury. This makes seeking help for serious issues very difficult. Compounding the stigmas around finding help with the lack of resources there to help creates a serious issue within our rural communities.
And this lack of resources literally just harkens back to low socioeconomic status. According to the ASPE research brief, individuals under the poverty line were twice as likely to have opioid use disorders compared to those above 200% of the poverty level. And low socioeconomic status doesn't even just mean less money. It often means less access to healthcare, mental health services, and education. For rural residents, these gaps are even more pronounced. When healthcare systems are miles away or too expensive, people turn to self-medication.
Oftentimes, this self-medication isn't healthy. People look to find the most accessible and affordable solutions to their physical and mental problems. And a lot of those times, these are drugs that people are buying on the street. Not only are these originally unsafe, but they could be laced, and so many bigger issues can arise when people turn to these types of drugs to deal with problems that should realistically have easy solutions. Women in rural areas often face additional barriers like lack of childcare, transportation, or fear of losing custody of their children if they seek help. According to the UNODC, 1 out of 3 drug users is a woman, yet only 1 out of 5 people in treatment is female, reflecting barriers to accessing care. Not only is our community failing people who are actively searching for help in general, but the systems in place today make it especially difficult for women to get the help that they are looking for.
And I think it's time we start talking about issues like this, things that we could be doing better, that our government could be doing better. And as far as where this issue is concerned, I think we could start tailoring treatment programs to address like women's needs, such as offering family-based services or in community care. We could ensure that more women get the help they need without risking their family stability.
Now let's go back to some of the issues that we addressed earlier. Some solutions for our problem in Terrace, the high rates of drug overdose deaths, could be mobile health clinics, harm reduction programs, or culturally tailored services that meet people where they are. It isn't just about treating addiction, but creating an environment where asking for help feels safe. It becomes increasingly important in these small communities like Terrace to separate ourselves from the stigma. It is an important first step to make sure that people feel safe to ask for help when they need it.
And to create environments like this, we need to revitalize the economies of these small towns. Addressing this isn't just about treating addiction. When jobs like mining, farming, or manufacturing disappears, the financial stress usually drives people towards substances like opioids as a form of escape.
This is where communities like Terrace and other rural communities need their provincial governments to step in. The government needs to be able to provide smaller communities like ours with the financial resources necessary to support programs that will give people looking for help the help they need. Now, looking into how scarce healthcare resources are in rural communities, it's also important to expand services like remote healthcare, mobile clinics, and community outreach programs, ensuring that rural residents can access life-saving treatments without traveling long distances.
This was a huge issue too. The only way my sister was able to get help was actually from a pop-up walk-in clinic that we have never had before. It was brought in as a resource during COVID, and it kind of came and went over the years very infrequently, and it just made it so that there was less of an anxiety in terms of like being found out from the community, and it was a very good resource that I think we need to bring back into most rural communities. Piggybacking on that too, I think education campaigns to reduce stigma, combined with some Good Samaritan laws that protect people seeking emergency help, could encourage more residents to step forward without fear.
It is important to instill the notion at a young age that it's okay to seek help when you need it. Nobody wants to be in a position where they're using drugs to take themselves away from the harsh realities they face. But it's important that they're not afraid to step out, say that there's something wrong with them, and get help. Now, when we're examining the increase in drug use when under the poverty line, it's important to look at how expanding medical aid and building affordable healthcare options in rural areas could provide the safety net that these communities desperately need.
And this kind of funding could provide so many more safety nets as well. Increasing funding for rural EMS services, training more local first responders, or equipping communities with naloxone kits could save countless lives. And it's something that is very easy to do.
This is just a situation in which the communities need to reach out and need help from the government. It's not that these communities don't want to help, it's that they lack the funding that they desperately need. If government intervention could help prevent people from overdosing, it would be worth it in the long run to put a little bit of money aside to support the services that these communities desperately need. As we wrap up, we want to leave you with a few thoughts. The drug epidemic in rural communities across British Columbia is more than a crisis of addiction. It's a reflection of the challenges these areas face: isolation, limited healthcare access, and economic struggles. We've learned that solutions may not be one size fits all. Strengthening mental health resources and expanding treatment options tailored to rural areas are vital steps. And perhaps, most importantly, addressing the stigma around addiction opens the door to understanding, connection, and real change.
So let's keep this conversation going. Let's push for solutions that don't just treat addiction, but address the root causes. And let's remember that the people in these small towns, our neighbors, friends, and family, deserve the same opportunities and care as anyone else. Thank you for listening, for caring, and for being a part of this important discussion. Together, we can create the change these communities so desperately need.
We'd also like to thank you for the opportunity to discuss something that means a lot to us. Drug addiction is something that we've grown up seeing, and it's affected our friends and families.
We hope this reaches the right audience, because for us, this isn't just a statistic or a headline, it's personal. We're both from Terrace, and we've seen how resilient these communities can be. There's strength here, even in the face of these overwhelming challenges. And we believe that with the right attention, resources, and policies, that strength can lead to real change.
Thank you for listening, and goodbye.